cosmetic surgeon discussing a safe way of enhancing the buttocks. It has become very easy. So you can enhance your body. Back to our discussion. So, Dr. Jani, the purpose why people go for this treatment, is it simply to look good for themselves, or is it to impress others?
Well, I think it's very interesting what you just said before is, you know, it's about acceptance. If you don't have any problem and you just feel good, and even though you're not perfect, then you have nothing to do in my clinic or in any clinic, you know.
Okay.
But if you feel like you want to enhance and you want to improve yourself,
yeah,
and maybe you feel a little bit insecure about something, then there's different ways to deal with that.
Okay.
And one of the things is to just be active and take a step and improve yourself. And if you feel like you want to do that, then why not? The possibilities are there.
Yeah.
The possibilities are safe, and it's easy these days. It's not it's not very tough surgery. So you know, like you said, you're a very religious person, right?
Yeah, I'm a dominee. Eh?
Yes, that's what I mean. So you have to put things in, you know, a religious perspective.
Yeah,
I guess so. So I think that a lot of people think that there's a big contrast between cosmetic surgery and religion. Don't you think?
I really don't think that way, because you know, when you want to get a better education, you go to school, isn't it? You didn't just stay raw the way you were born.
Exactly.
You began to enhance yourself. So if you can go to the shop and then buy soap to clean up your body, and then apply some cream or oil, looking good. I think that is the same way somebody who wants to enhance another part of the body. So I don't see any.
You don't see a conflict.
Okay. I don't see, except maybe it becomes excessive. But
exactly.
It becomes excessive. Like you don't want to look normal again. But I mean, you can enhance any part of your body. Just like people go to the dentist and they fix a new set of teeth. Yes, that's just the same.
It's the same. It's
exactly
the same. You're completely right.
So that's why I don't want anybody out there to feel guilty and they feel condemned. No, you have to fix yourself and look good for yourself.
Exactly. Only the people that are excessive. But you know, there's also people, like with what you said, people go to the shop, they buy soap because they want to clean themselves, want to improve their cleanliness. Yeah. Some people are excessive in that, and they have to be very over the top clean. Yeah. You know? So it's the same thing. Yeah. There's hardly in my clinic anybody excessive, and if I see it, I don't treat.
I mean, doctor, even let's be honest, when you look at the women today, the ladies out there, no one of us is so natural. Either you've gone to fix the eyelash, or you've gone to trim your eyebrow, or you've gone to put very long hair, or you are putting short hair, or you know, you're putting. So I mean, if you condemn what we are talking about now, that somebody went to enhance the body, then you better stop putting those cream and powder and all of those things.
Makeup,
So, Dr. Jani, your treatment, the training you are giving, is it only to doctors who are already specialists?
Well,
or any person out there who wants you to train him can be trained?
Any doctor, any licensed doctor is welcome. For example, I've had a number of family doctors because they've noticed that because now it's becoming more normal for people to have questions about maybe reducing the lines in their face between the nose and the mouth. This is a line that people don't like, or between the eyebrows. The frown line. Yeah,
what did you call it last time? You gave it a name, that long thing that comes up here, the dimple.
The frown line?
Okay.
Yeah, the furrow between the eyebrows.
Yeah.
And, as a physician, of course, you're licensed to inject your patients.
Okay.
But the technique, it's not very, very simple, so you have to learn from a colleague how it is done. So that means that you have to go back a little bit into the books and learn and read the anatomy and understand how the muscles of the face, how they are located and how they are in respect to each other. And so we take some time and we discuss the anatomy, and then we discuss, of course, what is, for example, Botox, and how does it work, and how do you inject it. So
well, Botox, somebody out there, Botox is the injection. So that you don't misplace it. You don't go about thinking it's the backside. Botox is the injection.
Buttocks and Botox.
Go on.
Yes. So yeah, I teach those physicians how to use the syringe and the needle and to enhance the beauty of their patients.
So what sort of materials are used?
Well,
for this treatment.
The treatment of which treatment?
I mean the enhancement of the backside.
The backside.
Yeah.
Okay. So I use a gel. And it is called Microlane. It is produced by a Swedish company, and actually it consists of hyaluronic acid. And maybe you've heard of hyaluronic acid because they put it in a lot of creams, and hyaluronic acid is already produced by the body. So it consists of very clear gel, and our body makes it, for example, in the skin, and in the joints, and the vitreous body of the eye, so the glass within the eyeball, is almost pure hyaluronic acid. So you can appreciate that because it's a substance that is recognized by the body as being, made by itself. It is going to be slowly degraded, and it's not going to be rejected.
Are there side effects to this treatment, and how normal does it feel in the patient's body?
Yeah, that's a very good question. That's a very good question. So, yeah, the first few days are a bit painful because there's a lot of pressure because there has been extra volume injected into the area, and but after the first few days, the pressure reduces and it will feel very natural. It will feel very soft, and and then slowly you really don't feel like there's anything in your behind that is not yours. So it feels completely natural.
Really?
Yes.
Really? Wow. So how popular is this treatment in the Netherlands? And you told us the cost already, about 3,000?
Yes.
How popular is it here in the Netherlands?
I do it every week.
Oh.
Every week there is a patient. And but because the Swedish company that makes the Microlane is the only company that produces this kind of gel, they have a monopoly, and so the gel is still very expensive. But maybe in the next few years the price is going to go down.
Okay. And then you will give some discounts too.
Yes, of course.
So how different is this augmentation from a breast augmentation treatment?
Well, it's really not much different because I do the same technique for the buttocks as I do for the breast. So there's only one small injection site, and through this little hole in the skin, which is a tiny little hole, I introduce my cannula, and with that cannula I put the gel, I inject the gel inside underneath the breast.
So what do you do with the breast? Is it to pump it up?
Yes. So
that the women can have breast that is like an apple.
Exactly. Nice.
So we are
nice and round and tight. Yes.
Would you be kind to come again some other time to talk about this one?
Oh, about the breast enhancement?
Yeah, because
I love that. Yes.
At least to be one of our regular cosmetic surgeons discussing this issue. So that,
I would be delighted.
Oh, that's thank you so much. So my last question before we sign up. According to the US-based research, 6% of patients who have Buttocks augmentation have complications. Is it the same? Here in the Netherlands, they have complications.
We have complications. For example, capsular contraction. If you have a breast enhancement, then there is a silicone, for example, silicone prosthesis inside the body, and the body can react.
Okay.
It can start to squeeze inside around the prosthesis, and then you have to get the implant out.
Okay.
With the microlane, the same can happen.
Okay.
It's the same thing. So there's something in the body, and the body can feel that there's something inside.
Yeah.
And there's some connective tissue starting to squeeze it. But with the microlane, it's not always necessary to get it out. There is a way to reduce this capsular contraction without taking it out. So basically, the capsular contraction can happen, but it's also treatable.
Yes, but the good news, Dr. Jani, is that people will have a better look.
Exactly.
That's the good news you are leaving behind.
It feels completely natural.
So tell our audience just what you expect them to do. Come on, go on.
Well, it's go and to the internet and look at microlane. If you go to microlane, that's the gel.
Tell us your clinic.
My clinic is Doctors Inc. Incorporated, and I'm located in Amsterdam, the south of Amsterdam. My name is Jani van Loghem.
So, people who want to contact those who have listened to us, in case they want to get more information, call us on 06846 06550 Radio Voice of Niger, or send your email concerns to us at voiceofniger@live.com. Niger is N for Nico, A for Adam, I for Ingrid, J for Jacob, and the A for Adam. voiceofniger@live.com.
And if you have any questions for me, send them to Reverend Helen. And I would be delighted to answer them for you.
Thank you, Dr. Jani. Thank you so much for coming. For the sake of time, listeners, you know, he will still be here for some couple of minutes, just maybe 2 or 3. You can give us a call. Feel free. You can even call and speak Chui. If you speak Chui, I think my husband will interpret it for Dr. Jani. So feel free and call us. Do those of us will be Nigeria. Feel free, call us. Just give us a call right now on the studio line 020-737-1619. Dr. Jani is still ready to take your question regarding this enhancement. It's a good opportunity. Thank you so much.